The first goal of mental health literacy is to help people foster and maintain positive mental health. This means we know how to help keep ourselves mentally healthy. Just like living a healthy lifestyle can help us to keep our bodies healthy, there are a lot of things that we can do to help keep our brains healthy, many of which we learned in this program. The ANT tools are a great place to start when we are thinking about becoming and staying mentally healthy. With the ANT tools in place, we can help keep our brains healthy, and we are better able to make long-term decisions when it will benefit us. Carrying all the tools at all times is challenging. Some situations may make it especially hard. For example, it may be hard to get enough sleep when we have a school project due or when we are in a fight with a sister or brother at home. We may have trouble exercising if we have an injury. The ANT tools help us to make healthy long-term decisions. The more we make those decisions, the easier they become in the future. Sometimes, the grasshopper may try to keep us from making those choices. But the more thoughtful we are about putting the ANT tools in place, the more we can foster our mental health. The second way that we can foster and maintain positive mental health is to make sure that we build resilient brain pathways. Resilience helps us to be mentally healthy. We build resilience as we handle the challenges we face in life. When we are out of our comfort zone because we are working towards a goal, we become more resilient and feel better about ourselves. We can use the 4 S's of resilience: self, situation, supports, and strategies, as a framework to use challenges as opportunities to build resilience. Knowing what to do to handle challenges helps us feel more confident. A key aspect of mental health is understanding how to deal with challenges. The next way that we can foster and maintain positive mental health is to make sure that we are doing activities that give us the neurochemicals we need. Many mental health disorders involve an imbalance of neurochemicals, and mental health disorders tend to begin in adolescence. In adolescence, it is especially important to get serotonin, feeling good about our accomplishments, oxytocin, good social connections, and adrenaline, appropriate, risk-taking behavior that makes us feel independent. Being intentional about the things we do helps us to get those neurochemical messages. Another way we can apply brain science to foster and maintain positive mental health is to be aware of reacts. While our brains are wired to respond to the social threats and rewards in reacts, not everyone responds in the same way. Being aware of the threats that we are most sensitive to can help us prevent difficult situations. A final way that we can foster and maintain positive mental health is to be mindful of our use of technology. Recently, the U.S. Surgeon General released an advisory warning that social media use poses a profound risk of harm for children and adolescents. Studies have shown a relationship between social media use and depression, anxiety, poor sleep, and low self-esteem. They also show an association between the overuse of cell phones and negative effects on physical and mental well-being. Technology companies intentionally target the grasshopper limbic system because it keeps us engaged. They do this through negative emotions, like fear, anger, and disgust, and through positive emotions, like similarity or a sense of belonging. Digital technology can be a powerful tool, but when we consider how to foster and maintain positive mental health, a big piece is understanding how to use it in a healthy way. We need to be aware of how and why we engage with technology and how it makes us feel.